We often speak of inheritance in terms of possessions or physical traits. Yet there's another, less visible legacy passed down through families: the echoes of unresolved trauma. This unseen inheritance can profoundly shape our emotional landscape. It influences how we perceive the world, how we relate to others, and crucially, how we develop emotionally. Understanding this connection is a vital step towards healing. Generational trauma refers to the psychological and emotional wounds that are transmitted across generations. These are not just memories, but deeply ingrained patterns of coping and relating. It stems from significant collective or individual traumatic events. War, famine, systemic oppression, or severe family dysfunction can all leave lasting imprints. These experiences impact the original survivors, but their effects ripple outward. They influence subsequent generations, even those who did not directly experience the initial trauma. So how does this inherited pain manifest as emotional immaturity? It often appears as a persistent difficulty in managing one's feelings. Emotional regulation becomes a constant struggle. Individuals might react disproportionately to minor stressors. They may struggle to identify or articulate their own emotions, leading to confusion and frustration. This can also show up as a reliance on unhealthy coping mechanisms. Avoidance, denial, or explosive outbursts become default responses instead of thoughtful engagement. Communication often suffers, marked by defensiveness or an inability to express needs clearly. Vulnerability feels unsafe, hindering genuine connection. Generational trauma isn't passed down through genes alone, though epigenetics plays a role. It's primarily transmitted through learned behaviors and unspoken family rules. Children observe how their parents or caregivers cope with stress. They internalize these patterns, even if they are maladaptive or emotionally restrictive. Family narratives, or the lack thereof, also contribute. Silence around past suffering can create a void, leaving younger generations to navigate unaddressed pain. Attachment styles are deeply affected. Insecure attachment, often a byproduct of trauma, can perpetuate cycles of emotional distance or anxious dependency. The consequences of emotional immaturity fueled by generational trauma are far-reaching. Relationships often become strained, marked by misunderstanding and unresolved conflict. Intimacy can feel threatening, leading to a push-pull dynamic. Trust issues may prevent the formation of secure, lasting bonds. Professionally, it can hinder growth and self-advocacy. Fear of failure or rejection, rooted in past family experiences, can limit ambition. Overall well-being is compromised. A constant state of emotional dysregulation can lead to chronic stress, anxiety, and even physical health issues. Recognizing the presence of generational trauma is the first courageous step. It allows us to shift from blame to understanding and compassion. Self-awareness is paramount. Begin to observe your own emotional reactions and patterns. Ask yourself where these responses might originate. Therapy, particularly modalities like family systems therapy or trauma-informed care, can be incredibly transformative. A professional can guide you through this complex landscape. Developing emotional literacy is crucial. Learn to name your feelings, understand their triggers, and practice healthier ways of responding. Cultivate self-compassion. Healing is not a linear process, and setbacks are part of the journey. Be patient and kind to yourself. The legacy of generational trauma is powerful, but it does not have to define your future. You possess the agency to interrupt these cycles. By understanding how past wounds influence present emotional maturity, we can begin to heal. We can forge new paths for ourselves and for future generations. This journey requires courage, but it offers profound liberation. It is a testament to resilience, transforming inherited pain into a legacy of emotional freedom.